Hey everybody, I'm Jill at the AAFE Training Center, and today we are treating Haley. We are going to do a little bit of cheek filler on her today, so we're super excited. She's been numbing for about 10 minutes with a topical anesthesia, and we are ready to go, so you can come on in and take a look at the procedure. All right, so when I'm looking at Haley, what I see is when I have her smile, she has volume here, but she sort of is lacking volume on this lateral cheek. So this is where I'm focusing. Most of my attention is trying to build this lateral cheek to give her a little bit more support. I'm using a heavy filler because when we are doing anything like cheeks, anytime we're trying to achieve a little bit of a lift or some contour, you need a product that has a high G prime, and that's what you're gonna get from a heavier filler. That's what's gonna give you that support and that lift. So you can see I am just going right along the zygoma here, and placing small boluses, again focusing on that lateral cheek. You always want to make sure that you're going deep with these injections based on the stiffness of this product. This is not something we want to lay close to the surface of the tissue. And you can see that I've aspirated with every injection that I'm giving. Aspiration is a chance for us to see whether or not we are in a safe injection zone. Aspiration certainly is not 100% accurate, but any opportunity that we have to keep our patients as safe as possible, I'm certainly going to take that. So you can see my technique here. Again, she was numbed for about 10 minutes with the topical anesthesia. You doing okay, Haley?
Yeah.
This is the first time she's had her cheeks done. How would you rate the discomfort?
It's not as bad as I was anticipating.
Okay, good. Just like pressure, right?
Yeah.
Okay. So when I'm doing the cheek, I do like to evaluate the patient as I'm going along with the procedure from all different angles, because we want to make sure that everything looks nice and even. I do tend to like the overhead view, because that way you can really see the shape take place along the zygoma. Another really important angle is your contralateral. So if I come and look at Haley from this side and I'm looking across to this contralateral cheek, oftentimes that's where you can pick up on some areas of deficiency that might need a little bit more product. So I'm gonna have her sit forward. Always make sure they're sitting forward. Once they're laying back, you can't really appreciate much because the tissue tends to just sort of, everybody sort of looks better laying back once gravity is taken over. Relax back, please. You okay?
Mm-hmm.
You can see she's using the Comfortox Vibe. That's a distraction tool that we like to use when we're doing injectables. Just creates that vibratory sense for the patient, and just acts as a bit of a distraction. How you doing? Good. Okay, sit forward one more time for me. Fabulous. So I'm gonna move to her other side, allow the product to pull a little bit of water, and then we'll reevaluate once we've finished her second side to see if we need any more or if we're happy with what we've achieved. So you can relax your head back. You okay, Haley?
Mm-hmm.
You can see she's got a little tiny bruise here. So when we go to smooth, it might be a little bit tender for her. You'll want to make sure though that you smooth it out nicely so there's not a bolus of product there. How you doing, Haley?
Great.
Good. Smile. Relax. So when I come overhead, I could see when she smiles here, she has a little bit of a gap. So that's why it's really important that you're evaluating patients from all angles. Smile. Better. Again, smile. Relax. Okay, so what we'll do is we'll go back with some arnica gel, which we use as like a little bit of a lubrication to smooth out that product. So I just put on both sides of her face. Just really trying to smooth those boluses, make sure they're sort of married nicely together. Actually feels pretty smooth. She has one tiny bruise here on this cheek. So that's the lump I'm feeling here. It's very small. Usually the way you can tell the difference between a bruise and product, the product feels like a pea, like it feels pretty firm. Swelling is just going to feel like soft tissue swelling, but if you're feeling something firm in there, chances are that's product, and this is your opportunity to smooth it out. With a heavy filler such as what we're using today, you can technically mold the product for about 24 to 48 hours, but the patient's in your office now. So make sure when they head out the door, it's all smooth. So they're not gonna call you in a couple of days and say like, my cheeks feel lumpy and now they need to be seen. So you can see we're just sort of taking this gel so that we can slide over the product and smooth it out really nicely. All right, so we just finished Haley's cheeks. You can see she's got a couple tiny bruises. That's to be expected. She's taking some arnica and she'll continue that for the next 3 to 5 days. And we're just gonna move on to her Botox here. I'm gonna lower her just a little bit. And this is just her standard Botox. We treat her every 3 months. In addition to cosmetics, we also treat her for chronic migraines and teeth clenching. So you can see we have her masseters marked, and we're also going to treat her temporalis as well. So important when you're evaluating your patients to come up with a treatment plan that's really individual for them. And is specifically catered to their anatomy and what their needs are, because every patient's going to have different anatomy. You look towards me just a little bit. Thank you. Doing okay?
Yep.
Okay. Safe injection is obviously very important to not only deliver the best results, but to avoid potential complications. And with Botox, it's not all about just the muscle that you're treating, but it's also about the anatomy that's close by and what we're trying to avoid. So, you know, we'd never want to move the product to any other muscle unintentionally because the patient can suffer some aesthetically unpleasing results. Around the eye is incredibly vascular, so I'm looking just for any obvious vessels that I would want to avoid, just to try and prevent any sort of bruising. Turn this way for me. Just a little more. Thank you. Alrighty, for the masseters, I'm just gonna have you clench and relax. This is really very effective for patients who suffer from chronic teeth clenching or grinding. We're relaxing the masseter muscle so that allows that muscle to, you're decreasing the muscle activity so they can't clench and grind so hard. Clench again for me, relax, clench. So for the temporalis, same thing. Lots of clenching can contribute to hypertrophy of this muscle. And so we want to relax that muscle to relieve their symptoms. We're going to do her bunny lines or the nasalis muscle, and then we'll come over to the other side for the other masseter and temporalis. So for this, it's really important that you know your anatomy. We certainly don't want any potential for affecting some other nearby muscles that affect our smile. And so if we accidentally treat the wrong muscle, she could have issues with her smile until that Botox wears off. All right, clench for us on this side, relax. You can really see that masseter bulge. Clench again. You see that? And then we're just going straight in that muscle. And we got one injection left. That's her left temporalis, and then she's all done for 3 months. Clench. You can really see that muscle sort of bulge out too when we have her clench. Relax. And that's it. She's all done.